I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. I'm Tamara Thomas, editor-in-chief of Urban Health Today, and I'm speaking with Latanya Weston, a nurse practitioner at Somatus. She's here to talk about patient-first healthcare and racial equity. Thanks for speaking with me today, Latanya.
Hello, good morning. How are you today?
It's great to finally meet you. Let's get started. So please talk about your background and your work for Somatus.
Absolutely. Um, I'm from South Georgia. I grew up there my whole entire life. I always knew that I wanted to be a nurse. I used to go with my aunts sometime to visit patients in the home, and it kind of piqued my interest. So I started out as a surgical technologist. I was the youngest person in the operating room at the age of 21, and I loved working in the operating room. It didn't give me the opportunity to have a one-on-one relationship with the patients, which that was something I always desired. But while I was working in the operating room, I noticed how a lot of times there would be procedures we would do, amputations, and they became one of the procedures that I despised the most because it was something about hearing the bone crack once we would cut through it. And it gave me chills. And during that time, most of those patients were African Americans like myself. And it just broke my heart. And that gave me a desire as I continued working in the operating room. I wanted to be a part of solving that problem. I knew I couldn't save everyone, but I knew that that was something that I could do. So I started going back to nursing school to become a RN. And once I became an RN, I continued to work in the operating room. And then during that time, I had a tragic fall downstairs and injured myself. And working in the operating room became really hard and tough. And that kind of prompted me to go back to school to get my master's and become a nurse practitioner and be able to educate and be a part of preventing people from getting on the operating room table and getting dialysis catheters put in and getting amputations so I could educate and teach. So that's kind of how I got into working for Somatis, being a part of the kidney disease family prevention and educating patients that are already on dialysis and those patients who could potentially be at risk for getting on dialysis.
So what was it, the accident, or was it the feeling that you had after the surgery that prompted you to make the change?
I would have to say there were a number of things. One, my personal experience with it. I had a sister that passed away at the age of 33. She
Oh,
was
wow, I'm so
Yeah.
sorry.
Yes, she had end-stage renal disease and was on dialysis, and she was not a candidate for a transplant because she all her life suffered from obesity. So she was unable to get a transplant. And I currently have a brother and a sister that is on dialysis. That was one of the things. And then also the experience in, I never want, and when I share this story, a lot of people can't believe it, but I worked in the operating room 15 years. I never once put a dialysis catheter and none other than an African American person, or did an amputation on anyone other than an African American in 15 years. So that, and also when I had the accident, all those things together kind of gave me even more motivation to go back to school. And once you're in the office and you're working one-on-one with them, you can have a relationship with them. You're able to teach. While I was working in the operating room, there's only moments when you are able to talk to them and take them to the operating room, and then they're gone. You don't see them again. But when you're working one-on-one with them, you're able to, impact them more.
You wrote that in your U.S. News and World Report article. You wrote that you could tell your patients of color didn't fully understand the implications of their disease. Can you go into that with some more detail and maybe break down where on the continuum between the provider instruction and patient understanding, where that breakdown is?
Absolutely. Many people are not even aware that they have chronic kidney disease and they don't understand exactly what it is because oftentimes you don't have any symptoms at all in the early stages. Once you do have symptoms, sometimes you may have a little bit of fatigue. You may start having swelling in your legs or feet, different things like that. Maybe some itching of the skin. Um, Generally, you don't get that till later on. So when they come in, they don't realize they already have it until we do the lab work. So once you start discussing it with them, they clearly do not understand. And then in the African American community, sometimes you may run into people who are illiterate. They may not be able to read. And that's why I love Somatis because in our program, we actually will help them with that. Our patient health advocates will actually go out and assist them, if they're having issues with being able to read and understand. And so when they come in, would come in the office when I was working in primary care, I would actually sit down with them and go through everything with them, educate them. I always wanted to make sure that when they left the office, they had something in hand. And if they had a family member that they could depend on, I always made sure the family members would be with them when I would educate and teach them and, build a rapport with them, have a relationship with them.
So, what is patient first healthcare?
Patient first healthcare is value based. We treat the patient whole instead of, considering or thinking about the number itself, the volume of patients that we have. We treat the whole patient, whether it be social determinants of health, mental instability, because behavior health has a lot to do with a lot of times why some patients may not be compliant with their overall care plan. So we take a patient and we look at every aspect of their care. When a patient is not being compliant with their care plan, there may be a reason, because oftentimes we may think that patient is just being hard-headed when that may not be so.
Okay, well, can you talk about what impact this whole person approach that Somatis Institute is making on kidney care with patients?
Yes, ma'am. Um, we have been able to, we call Somatis like another family when it comes to our patients. They can call upon us when they can't call anyone else. We Our care team members go into our patient's home. We're able to spend time with them. Generally, in a primary care setting, you will only get 15 minutes, sometimes 30 at the most. We go into the patient home. We're able to assess their surroundings to see if they're having any issues being able to afford their medications, because medication compliance is one of the issues that can cause renal disease. We make sure they have the appropriate foods that they need to eat. We want to make sure they have transportation. They're able to get to the doctor's appointments. That's another issue, one of the social determinants of health, access to care, being able to get there. We also want to make sure they have proper monitoring devices, like being able to check your blood pressure, being able to check your blood sugars, as diabetes and high blood pressure are the top two things that cause kidney disease. We want to make sure that, they have adequate social support, family support. If they do not have that, then our social workers get involved. And all these things together, we have found that we have great outcomes. We have seen where our patients that had a lot of hospital admissions going back into the hospital, we have seen where those patients are no longer going in and out of the hospital. They call us first, and we're able to address the issues that they may be having.
Then would you say that your education efforts are saving lives and preventing operations resulting from kidney disease? What are patients saying?
Absolutely. We've actually had some patients, say that we have saved their lives. We, through our we have registered dietitians on our teams. Sometimes it's just changing different things that you may be eating. We've had people like, sometimes, and it's difficult with the food insecurities because unhealthy foods are sometimes, the only thing that, you can afford because they are cheaper. It's hard to buy fresh produce all the time, and getting canned goods, which are high in sodium and
Mhm.
lowering your sodium content, is very important when you have kidney disease and high blood pressure. So, our dietitians will teach them, if you can only afford canned goods, you want to make sure that you are draining them, rinsing them. We try to meet them where they are, what they already have. And if we can, we reach out to community resources, to, food pantries and different things, to do whatever we can to make sure they have what they need. And, we have a lot of people that, will call us up and, be very thankful.
What about do you have social workers helping people qualify for, say, Medicaid so that they can afford a wider variety of foods?
Absolutely. So we do, and some of our patients are older, so they're not very tech savvy.
Mhm.
So our social workers will help them fill out applications for the SNAP program to see if they qualify. And also, when they cannot afford their medication, they'll help them with the extra help program to apply to see if they'll qualify for extra help to pay for their medications. And if they need assistance in the home, they don't have internet connections or anything like that, our PHA goes out to the home with one of our laptops and will assist the social worker in getting it done.
Hmm. I just want to pivot for a second. So you talked a little about your early personal experience with kidney disease. Can you talk a little about your personal experience within your community? What did you see growing up?
Well, like I told you earlier, I am from South Georgia,
Mhm.
and it's a small town where it's grown just a little bit. Here in the Atlanta area, there are more dialysis centers, but the small town where I am from, we had only two dialysis centers, in which, as I stated earlier, my sister, I can remember her used to come pick her up from to go to dialysis, but I was so young. My sister passed away when I was 15. I had no idea, what dialysis was during that time, but I knew, kind of felt that it wasn't a good thing because she would, be sick afterwards. But during that time, I felt that it was keeping her alive. She was, in my life a little longer because of dialysis during that time. And I used to see people all the time, their arms would be swollen and have these lumps on them. And I would hear people say, they're going to dialysis. And I used to think that's horrible, and,
Yeah.
if dialysis is doing that, I definitely don't ever want to be on dialysis and don't want, my family members or friends to have to experience that either. So, and I forgot to mention that. That's another thing that kind of, encouraged me to want to go back to school and do whatever I could to, be a part of education and prevention.
Wow, that's a lot. So it sounds like Somatus and yourself are making a huge difference in patients' lives.
Absolutely. I actually working for Somatis was, such a blessing because I always said that I wanted to be a part of, prevention and on a spiritual level, God told me this is what you wanted to do because I said that I wanted to prevent kidney disease, amputations and different things. So when I had the opportunity to work for Somatis, it, came to fruition. And, it was such a blessing. And I believe in everything that Somatis is doing for the people.
What do you guys do to improve health literacy? I know you send people out to people's homes, but like what specifically are you are doing to improve health literacy among patients? Because without
Okay.
the health literacy, the other
We
stuff doesn't make much of a difference, right?
we have, and I know, I mentioned about, older people, patients being tech savvy. We actually have webinars, for our patients that they're able to log on to be educated concerning their kidney disease, nutrition, dietary measures. And like I said before, if they want to be a part of that, our patient health advocates are more than willing to always go to their homes so they can be a part of that, because as I spoke earlier, we have those people that are illiterate that do not read, are able to read and write.
I'm curious from your experience. You talked about higher rates for kidney disease and kidney failure for people of color. Why do you think that is?
Growing up in South Georgia, my family was not definitely not well. A lot of times there was no insurance. There was a gap in insurance, and
Mhm.
just not able to afford it. And I see that a lot right now. People do not have insurance. Although, there have been some strides, in education, and, college graduates, African Americans are still, paid less to do the same job a lot of times. And they simply just cannot afford insurance. And therefore, their health needs are not taken care of. So by the time they do go to the doctor, they already have, stage 4, stage 5 kidney
Oh,
disease.
wow.
Yes, and end up on dialysis. Um, I've seen that through my work. And it's sad when you hear those stories, it's too late. Also, in different communities, African American as well as Hispanic, that's just not primary care centers in those areas. And if there are centers there, they're not getting the best care that they need. So that's another problem. They don't have enough primary care centers in their neighborhoods and in their areas. And back to the knowledge deficit, they don't have the knowledge about their health, about their care, what they need to do. They don't know the medications that they are prescribed. They don't understand what they are for. So they don't know the importance of them. Therefore, they don't take them. They don't understand. I've had patients tell me, I feel better when my blood pressure is a little high, but they don't understand why.
Really?
Absolutely.
But they
And
feel better when their blood pressure is higher?
absolutely. And I'm going to explain that to you.
Yeah, please do.
If your body is used to a high blood pressure, of,
Mhm.
of course, that's what your body is accustomed to. The moment you start taking your medications and your blood pressure normalize, you're going to be a little weak. You may be a little dizzy at first because that is your
Ah.
absolutely. So they've experienced their blood pressure at a normal level. And so it makes them a little sick. And so that's why they say, I feel better when my blood pressure is high. So I have to educate them and teach them, that and work with them on taking their medications and ease them into it. And then, get them to understand if their blood pressures continue to stay high, what the outcome can be. And once you speak to them in that way, and then I write a lot of things and write pictures and things on paper for them as well so they can understand it better.
Wow.
And also I do things, with patients, when I worked in primary care, if I had a patient who was overweight, had trouble with their diabetes, I would do a diet with them and we would weigh in every week. So who lost the most weight? They love things like that. So that's how you treat the whole patient.
One
You
more question. Do you think having providers that look like you has more of an impact on patient outcomes than, say, someone from a different culture?
It absolutely does. They love it, and I've worked in places where I was the only one that looked like me. And it made a great impact. I would, share personal stories with them, and that would encourage them and motivate them. And that was going to be another thing I was going to share with you about, why a lot of African Americans are impacted by kidney disease because it's the lack of motivation. They're not motivated when people have habits and they grew up a certain way and they're used to doing things
Mhm.
one way, they, they don't have the motivation to do better because they have grown up around people doing things the same way. And therefore it's hard to get them motivated to do better a lot of times. So when they come in our office or I go into their home and they see me, and then I share some of my story and why I do what I do, it motivates them. And a lot of times I get to see them transition and change.
That's absolutely amazing. It sounds like you're really making a difference in people's lives. And so this is preventing a lot of the hospitalization or rehospitalization. And what does that do in terms of like people needing the dialysis, or does that not change?
It does. Remember when I talked to you about people coming into the office and not knowing they have kidney disease,
Mhm.
and we
Right.
get there,
And it's
they're
too late.
and
Right.
it's too late.
Mhm.
So when we have this program and we can prevent rehospitalization and actually control their blood pressures and their diabetes, then we can prevent them from what we call crashing into dialysis,
Wow.
like skipping over the stages and going directly to dialysis. So that's what we want to prevent.
I would think you would also want to prevent the disease to begin with, like maybe earlier education so that people are not eating the diets that cause or exacerbate the kidney disease to begin with.
That's one of the most important things that we do with our dietitians. We have some fantastic dietitians. We educate them and teach them how important the diet is, because that's what the kidneys do. Our kidneys clean up, it filters the waste in our urine, the calcium, phosphorus, and we talk about all the foods that you eat that has those things. Because if your kidneys are not working, what's going to happen, all those things are going to build up in your blood. So once we explain it to them that way, they understand that, oh, okay.
Wow. Wow. You know, this is another thought that I had, and feel free to answer or not answer this one. But I was wondering about the regular consumption of alcohol. You know, everywhere you turn on TV, for example, you see, people partying and drinking alcohol.
Mhm,
And I
mhm,
just wonder if that culture has sort of rubbed off on people. And, because you hardly ever see people drinking water. Do you know what I mean? Like,
mhm,
you always see people, and it's become like a running theme, or like even a joke, where you always see people with like alcohol in music
mhm.
videos and movies and TV shows. I need a drink, and they've got a drink in their hand. And I just wonder how much of that is part of the problem
We
too.
we we deal with that too. We deal with addiction and substance abuse, and
Mhm.
through our social workers, we're able to get them help as well. A lot of our patients, they have dealt with their substance abuse and alcoholism. Yeah, but when we do get one who is still struggling with those issues, we do offer support for the alcoholism, and we encourage them concerning, alcohol consumption and the impact that it can have on renal functions. But you're right, I see that all the time. You don't hear people pushing, water and drinking. I deal with it with my own mom.
Wow.
She's not a water drinker. And this is on a personal level. When I first started working in the operating room, it changed my life. I was very unhealthy. I never drank water, and I always ate fast food. I now I've only drank water since I was 23.
I remember I used to ask my mom when I was growing up, well, why don't you drink some water? Why don't you drink some? And she'd say, I don't like the taste of it.
Right.
And then she'd say, and besides, I get my water from coffee.
No. And
And
once you add something to it, it's no longer water. I tell
no,
everybody.
exactly, exactly. Once you add juice, once you add sugar, once you add anything to it, it's not pure water that your body needs anymore.
I get my patients the pinkies where I was like, pinkies where I was like, for every coffee you drink water. I said, for every soda you got to drink some water. And believe it or not, it helps them cut back. Because the
Oh,
next I
see,
talk
that's
to
good.
them, yeah.
Never understood that. You got to drink water.
Correct.
Latanya Weston of Somatus, thank you so much. This was a great conversation. Really great talking to you today about this. Just keep doing the work, man. I really appreciate
I
you.
love it. I love it.
Thanks. Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.